Hi everyone, I'm Giovanna, and this is our new CDI program project. We chose Charleston Area Medical Center Memorial Hospital to develop a CDI program for their facility. Our program is committed to enhancing accuracy, quality, and completeness of clinical documentation. Our mission is to support patient-centered care, ensure clinical excellence, and enhance collaboration between providers and HIM professionals. Through education, data integrity, and continuous improvement, we aim to reflect the true complexity of care and optimize outcomes for our patients, providers, and community. The Charleston Area Medical Center Memorial Hospital is accredited by DMV Healthcare USA. They have met or exceeded all patient safety standards that are set by CMS. This is a level 4 trauma center. It's a short-term acute care hospital. It's nonprofit and has 1,138 beds. As of December 31st, 2023, these are their financials. Their facility assets sit around $2.6 million. Their liabilities sit around $1.4 million. Their net assets are $1.1 million. Their expenses for employees, salaries, benefits, and a lot more are $2.2 million, and their unrestricted revenue is $2.3 million. There are interns and residents that have many opportunities to join their residency program. They can experience a lot of all the clinical services that they provide at this hospital, except anesthesia. Anesthesia can only be taught at the general hospital of the same facility. The types of services they have consist of electrophysiology, family medicine, gastroenterology, HIV care, hemophilia care, imaging services, oncology, pulmonology, and urology. This is our CDI core team committee. The program will be residing in the Health Information Management Department. The CDI reviewers will report to the Director of HIM. Our executive sponsor is the Chief Financial Officer. Our physician advisor is the Medical Director. The CDI core team will consist of the Director of HIM, the CFO, the Chief Medical Officer, the CDI reviewers, there will be 10 of them, the CDI specialists, Quality Improvement, Director of Compliance, and the executive staff. There will be 10 clinical documentation improvement reviewers, like I stated before. I feel like this is a good number of reviewers. This way we can ensure that documentation is taking place during appointments with physicians. Also, it allows for physicians to be split up evenly so that each clinical documentation reviewer has the same amount of physicians that they're examining, and making sure that documentation is being done properly during appointments. The CDI reviewer will have the title of Clinical Documentation Improvement Specialist. What is required of a CDI reviewer? Well, you must have a title of a CDI specialist. You must have 2 years of experience, at least, an associate degree or higher, an HIM certification approved by the Commission on Accreditation for Health Informatics and Information Management Education. You must have a CCS, RHIT, or RHIA credential and knowledge of medical terminology, human anatomy, pharmacology, and pathology. Without knowledge of these things, you will not understand what is going on and what you're even reviewing. So you must have knowledge in these areas to be a good reviewer.
Our training plan overview section. The top areas we're going to focus on for education is our cardiology section, oncology, internal medicine, and surgery areas. Our training methods are going to consist of interactive workshops, e-learning modules, one-on-one coaching sessions, and case study analysis. Our training is going to last for 2 weeks, and our ongoing training is going to last through quarterly sessions. The training content is going to consist of accurate documentation, common documentation deficiencies, query process and compliances, and the use of the EHR. How we're going to assess this training is pre- and post-training assessments, monitoring of documentation quality, and feedback surveys. Here's our sample plan for the physicians that we composed of. In week 1, we're going to start with the introduction to CDI and its impacts. In week 2, we're going to get into the documentation requirements. In week 3, we're going to talk about the EHR and the documentation tools and best practices. In the last week, we're going to review common case scenarios and documentation. And then here's our query process. We're going to have multiple choice, yes or no's, open-ended questions, and then we're going to have a combination of all 3 of them. And then here's our sample query. For a multiple choice, here's an example of it. Based on the patient's symptoms and lab results, which of the following diagnosis best fits the clinical picture? For 2 yes or no's, was the patient...
My name's Caitlin Hunt, and one of the 2 sections I did was program reviews, analysis, and measurement. What types of charts will be reviewed and how often will the CDI reviewers review charts? The types of charts that will be reviewed will be inpatient medical records, and the type of documentation that are in these patient records focus on accurate coding, procedures, and diagnosis, and for how often CDI reviewers review charts are every 2 to 3 days. What method of review will take place and how? The method of review that will take place will be concurrent and retrospective, and this is because concurrent reviews take place during treatment and then retrospective reviews take place after treatment. What methods will be conducted to manage present on admission and hospital-acquired conditions? The methods that will be conducted to manage present on admission and hospital-acquired conditions include surveillance programs that are very attentive, having precise documentation, and a national quality strategy to improve healthcare quality. All of these concepts are used to enhance patient experience while improving outcomes. What data elements will be collected to measure program effectiveness? Patient outcomes, which will include having surveys track data from patients about their stay. Program participation includes the number of participants in programs or the number of times patients show up to appointments. Community health metrics includes changes in certain health conditions like diabetes or heart disease. And community investment metrics, which are community investments that are created by the hospital for services. What target metrics will be set? The target metrics that will be set include these 2 patient safety metrics used to monitor certain types of hospital-acquired infections. Include an example of 2 to 3 reports or dashboards that will be used for reporting program metrics. For the 3 dashboards, I put patient perception dashboard, clinician dashboard, and healthcare organization dashboard. What audience will review these reports? The audience that will be reviewing these reports will be the executive team and the staff. The next section I did was additional recommendations. So for technology recommendations, I put audio/visual solutions for public spaces for patient engagement and communication, which could be put into conference areas. Also virtual reality for patient education and communication. This will allow doctors to show 3D models of conditions and treatments from a patient. Future CDI, what will be the next steps for the program, and will reviews be expanded to other areas? The future CDI will go into outpatient areas with the use of emergency departments or observation. The next steps for the program could include CAMC applying more collaboration with outpatient providers or coders and start adopting technology to support these outpatient CDI programs. Include any additional recommendations you have for program development. A recommendation I have for program development would be paying attention to the program's performance and making adjustments to meet the hospital's goals. And these are our sources for our presentation.